In April of this year, I unfortunately went through the experience of contracting COVID-19. I had gone through first a headache, a fever. Within the next 2 days, I was having the muscle aches, the chills, the sweats. It all just kind of came coming very quickly within the first 2 to 3 days upon symptom onset. And I spent the next, I would say, between 7 to 9 days primarily in bed. I was trapped in my room to protect my family and my friends. I didn't leave it. Being lonely, freaking out about the safety of my own family and friends, and of course the cabin fever, it was a very challenging situation, not only due to my physical health, but also my mental health. 48 hours before the actual symptoms had started, I had gone out for like an 8-kilometer jog with a friend. I tried to be active. I try to exercise 5 days a week if I can.
Yes!
I would say the recovery process from it, and at least affected me, I would say for about a month or so at least afterwards. So for the next exercise, we're going to try and get your range of motion a bit better. So you can lift up your leg for me. I remember the first 2 to 3 weeks of work, I would go through my 8-hour shift, come home, and then just sleep for the next 12 or so hours, just because my body was just so physically exhausted. Many individuals like myself who are fairly young, we take for granted that, you know, it's a disease, but we know from the information online that we're likely to get through it. However, for myself, I don't think I've ever been as sick as that ever in the past. Are you all set? 1, 2, and 3, let's go. What I want people to know is that the advice you've been given about wearing the mask, about keeping your distance, it works. And the main thing is that not taking for granted that you may or may not have it. Good. Walker left and right. There's this new virus, there's this new disease that's within our homes, within our community, which unfortunately closely mimics the flu. It's going to be a lot more challenging to see exactly what's going on. I think this year I'm taking the flu vaccine for myself, for my friends, my family, and of course the community as a whole. I think I owe it to the community and all those around me to reduce the mental, emotional, and physical stress of what could be COVID-19. That I can very least take off one thing that could be a source of stress, a source of difficulty, and that if I get sick, things will be a lot more different if I had it this year.